Hello friends, hello everyone, welcome back once again to this channel. We want to look at something new. We are continuing with pharmacy laws, course unit pharmacy laws and regulations, and we have a number of laws and regulations that govern a pharmacy practice in Uganda. So we have the National Drug Policy and Authority Act, and then we have Pharmacy and Drug Act, we have Allied Health Professionals Act, and then we have National Drug Policy 2005, and we have National Medical Stores Act 2001. Okay, so these are the different laws and regulations that governed the practice of pharmacy in this specific country that we are in, and they are as you can see them. So we see that the Pharmacy and Drug Act was made or formed or was passed out by legislative part or branch of the government in 1970, and it was endorsed or signed by the what? By the executive branch of the government. So every act is passed out or is agreed on and then signed by the legislative act or branch of the government. Okay, so that is what I needed us to look at before we start something new on our second lecture on pharmacy laws and regulation. And this will be the outline on our second lecture on pharmacy laws and regulation. We are going to look at ethics and ethical codes, what they are, and then we are going to look at the importance, relevance of ethics and laws for the pharmacy profession and the society. And then we are also going to look at the relevance and functions of legal bodies mandated to enforce pharmacy practice and profession-related laws and regulations. We shall also look at the roles of various cadres in pharmacy profession and how related they are to each other under the law. The process of registration of a pharmacy assistant, we are also going to look at it. A pharmacy technician, we are also going to look at it. However, a regulation guideline or process or registration process for pharmacists may be a bit different. Okay, but we are going to look at for pharmacy assistant and a pharmacy technician. So let's start right away by looking at the importance or relevance of ethics for pharmacy profession. So we see that there are a number of things why we need to know or learn about ethics. And in the previous class that we shall have, or you can check out in this same lecture, or I mean in this same channel, where we looked at introduction and to pharmacy laws and regulations, and then definition of specific terms. So you find that in that specific lecture, we looked at what ethics are, what laws are, what acts are. We defined some of the terms. However, here we want to know why is it relevant for us to have that specific human character, human behavior that a specific personnel pursuing a specific profession or are qualified to do or perform specific activities of a profession is ought to act or is ought to behave. So we see that professional ethics are principles that govern the behavior of a person or a group in a business environment. A professional ethics provide rules on how a person should act towards other people and institutions in such an environment. Professionally, ethics should be professionally accepted standards of personal and business behaviors, values and guiding principles. Codes of professional ethics are often established by professional organizations to help guide members in performing their job functions according to the sound and consistent ethical principles. So we find that professional ethics are principles that govern the behavior of a person or group of people in a specific environment, in a specific profession, in a specific cadre in the medical field. Okay, so we have different cadres. Different cadres are all to behave or act in a different way. So we see that professional ethics, this is just repeating the last slide. We have repeated it just to make more emphasis. And I didn't want to repeat it like verbally, but you see that we have repeated it so that you pick the main concept. So here we see that what are the reasons for laws and regulations for the pharmacy profession. This is the relevance of understanding the laws and regulations of a pharmacy professional. You see that consumers have no way to determine product quality. Our patients cannot determine product quality. However, it is us who are giving the care to the patients who are in position to what? To determine the quality. So we should be able to have the same standard, the same guiding principles for all pharmacy professionals across the country, not by per region, not per district, and the rest. And then we see that the use of ineffective, poor quality, or harmful medicines can result into therapeutic failure, exacerbation of diseases, and then resistance of drugs and sometimes death. So when we do not have regulations of the profession, we find that we shall misuse, we shall ineffectively use the medicines. And what is the result or what is the outcome of us ineffectively using the medicines? You're going to bring out harm to the patients. You're going to bring out about therapeutic failure. The drug is not going to work. And then we see that many parties are involved. So many parties are involved in the in provision of care. For you to provide effective care, you need a patient to be there as your final consumer, as your final person. And we can determine the type of care that we have given based on how a patient recovers and how a patient gets better, or how a patient complies and responds to treatment that you have given to them. So we see that many parties are involved. So since so many parties are involved, there should be something guiding these different parties on how they are ought to participate, or how they are ought to offer their services, how they are ought to offer their duties to specific areas of their specialty. We see that we need patients, we have health providers, we have manufacturers, and then we have salespersons. So salespersons are in charge of marketing the products, and then manufacturers are in charge of manufacturing the product that we are going to use on patients. A healthcare provider is responsible of giving out care or patient care to the patient, whereby it ensures that a patient receives the right medicine, the right dose, and you are using the right medicine for managing the right condition. Okay, so we have the serious consequences, including injury, death, can result from lack or misuse of medicines. Pharmaceuticals concern the whole population. You see that pharmaceuticals are costly, hence need to be a stringent regulation. You need a regulation since we don't want to waste resources because of negligence, because of people not doing the right thing, even when they know what is supposed to be done right. Okay, so relevance and functions of legal bodies mandated to enforce pharmacy practice and related laws and regulations. So there are different bodies. Excuse me. There are different bodies that are mandated to enforce pharmacy practice, that are mandated to supervise, that are mandated to follow up, to determine the quality of care that pharmacy professionals are offering to the community, are offering to the consumers, which are our patients, our final consumers are the patients. So we see that we are also going to look at the outline of the relevance and functions of these legal bodies, and we shall also list in the in the last slides of this presentation, meaning in among the last lectures of this presentation, not necessarily today, but other lectures of this presentation, we shall look at them. So the relevance and functions of laws and laws for the pharmacy profession and the society. Why is it relevant to have laws that are regulating a pharmacy profession? You see that we establish permitted and prohibited conduct for a pharmacy professional and a pharmaceutical outlets. So when you move around the streets of Uganda, you are going to look, or you're going to find what we call community pharmacies. And the nature or the design or the shelving is going to be ideally related to one another, because that is like the standard that this specific profession or professionals have designed, so that they regulate how these medicines are stored in these different pharmaceutical outlets. Okay, they set the criteria that a pharmaceutical outlet must satisfy to be licensed by a state. Okay, so you find that this also, the function that it performs, it is to set the criteria that a pharmaceutical outlet must satisfy to be licensed. The laws and regulations set the criteria that a pharmacy professional must meet to be registered or to be licensed. Like I was telling you, there are different processes or procedures for registration or of attaining a practicing license for a pharmacy professional. So the same way, or we find that the pharmacy assistant and a pharmacy technician and what we call a pharmacist may have different processes that they take in order to attain this. And this is all guided by the regulations, the laws and regulations that govern pharmacy professionals. Okay, so you find that it is relevant for us to have it, so that everyone has to pass a specific process in order to get licensed, so that everyone is able to attain a license, and which is renewable yearly, for practicing in the field, for practicing their profession, for practicing the skills and the knowledge that they have got from class. The laws and regulations establish the pharmacy professional's responsibilities for operating a pharmaceutical outlet, dispensing prescription medications, and then providing other pharmacy services such as counseling patients about their medications, giving drug information, giving patient information about the conditions they are having or they are presented with, giving the conditions or giving guidelines to patients on how medicines are going to be taken, and then what medicines need to be taken before food, after food, and the rest. So you find that it is their responsibility to also regulate how people dispense, how people prescribe, how people provide care to the patients. Okay, they establish the requirements for information that must be on a prescription level, such as the name and the quantity of the prescribed. So a label, standards of a label or qualities of a good label has a number of factors or has a number of things that we look at. However, some of them we have the name and then the quantity to be prescribed that a patient has to take. Those are the vital ones. However, others as well, the name, the strength of the medicine, and then we have we can look at maybe for sign language. We find that our packing envelopes also have the diagrams. For us who have practiced in the field, we have already seen how our packing envelopes are presented. So we see that the laws and regulations also provide for discipline and penalties for violation. Okay, so you cannot know whether you're doing the right thing or not if at all there is nothing that you are following. Okay, if there is something that is standard, you are able to grade yourself that I messed up here, I messed up there, and so many other things. So we see that there are roles of various cadres in the pharmacy profession. So we see that processing of prescription care of patients or clinical pharmacy. There is also monitoring of drug utilization is a role. And then making extemporaneous preparation and small-scale drug manufacturing is a role of a pharmacy professional in this country. Providing drug information to other healthcare professionals is a role. Carrying out health promotions is a role. Procuring and receiving drugs in a health center is a role. And then they also participate in sales and marketing of drugs. Ensuring quality assurance of the drugs right from manufacture or right from the raw materials that are going to be used for manufacturing of these medicines until when a patient has used it or until it reaches a final consumer. And our final consumers in the field of medicine are the patients. Okay, so you find that there is a tendency, or we have to ensure quality assurance of our drugs. Training of other healthcare workers is also our responsibility as pharmacy professionals. So we continue, or we are going to look at what is the process of registration of a pharmacy assistant. So it can be either pharmacy assistant or a pharmacy technician. It is the same process. Like I said, a pharmacy assistant and a pharmacy technician may have the same process of registration, since all of them or their licensing or attaining of a practicing license is based on a same body, or it is governed by a same body, which is Allied Health Professionals Council. However, for pharmacists, it is governed by what we call Pharmaceutical Society of Uganda. So I don't know about other countries. You may also have different formats. You can find time and find out how you always do it. However, there may be similarities, maybe the names of organizations that are awarding these licenses may be different. So a pharmacy assistant or a certificate of registration is obtained from Allied Health Professionals Council. The applicant who has fully finished the course of certificate in pharmacy from a recognized institution will fill up the appropriate application form as described by Allied Health Professionals Council. So, like I said, for pharmacy assistants and pharmacy technicians, you will register, or it is the same body that licenses or that awards you a practicing license, awards you that or acknowledges completion and your competence to be ready to deliver service. All those other things we have looked at in the last slide, you find that you are able to deliver it to the community as long as you are done with the course. Of course, getting done with the course is passing and then attaining the skill that you're required to use. Okay, after filling the form, proceed to pay the described fee. A described fee will be given to you for both a pharmacy assistant and a pharmacy technician. On payment of this prescribed fee, the registrar shall enter the name of the applicant in the registry, okay, or in the register. Then the registration number shall be issued to the applicant. The registration or the registrar shall cause a list of all pharmacy assistants whose names appear in the register after 3 months of application. So after you have made payments and then you are given a number, so that number is what you see in your license, like after you have got it. However, this license doesn't it takes a period of 3 months for it to get ready for use, for it to be given to you, or for it to, because they have to include, or they have a process that they will take, and this process takes 3 months. So we are required that after you have you have paid, you have registered, you have filled a form, you are expected to have this license by the end of the 3 months. If the council is satisfied that the applicant is of good character and he or she has fulfilled all the requirements of the society, then you are in position to receive your license, practicing license, and then the registrar shall direct the applicant to collect the certificate of registration. They collect your practicing license as well as the certificate of registration. So we have what we call ethical principles or a code of conduct. Code of conduct for pharmacy professionals. Ethical principles underpin all professional code of conduct, where we see that ethical principles may differ depending on the profession, depending on the cadre. For example, professional ethics that relate to the medical practitioner will differ from those that relate to lawyers or real estate agents, or we can say army. All right. So we find that they are not always the same. So these include, we have what we call autonomy, non-maleficence, we have beneficence, we have justice, we have confidentiality, and we have veracity. We are going to look at them one at a time so that we understand what they are. We also have confidentiality, and then we have privacy. A patient has a right to privacy. A patient, that's why most of the procedures that you have to do to a patient, you have to screen, like there is screening of the patient's bed. So more highlights on the points that we have outlined already. We see that diligence, the provision of services in reasonably prompt and thorough manner, including proper planning of services. Okay, so it is a code of conduct for medical practitioners, medical professionals. Autonomy, self-determination on part of the patient to decide on the treatment he or she wants to accept. So autonomy is you having in like giving a patient a right to choose what is okay for them. So there are patients who come to the facility and they say, I am okay with injections, I am not okay with what maybe tablets or solid dosage forms or swallowing. So they can decide, they can choose. You describe the procedure you're going to do or conduct to them, and then let them decide or accept or consent. Okay, so it looks as getting a patient consent before any procedure is given to or done on a patient. Beneficence requires an allied health personnel to advocate for the patient and take action in his or her own interest or best interest and protect the patient's right. Beneficence is like you're doing good to every patient. Every patient deserves equal right, equal treatment. Like you don't favor others and others not. If everyone has to follow the line after doing triage, let everyone follow the line as you treat them, not others. You are handling others before others, or taking priority based on the color, based on the race. It is not part of a medical ethic. Okay, we have what we call veracity, is concerned with being open, honest. Be honest to your patient. If you have a condition, don't fear to inform them about the condition. Be honest with them. Tell them this and this will take a period of this month. This treatment we are giving you, and if there is no cure for that specific disease, tell the patient, however, this medicine has no cure. Okay, so be honest to your patient to give them all the information they require and be truthful to all of them. That is veracity. Non-malfeasance, the principle requires healthcare professionals to protect individuals who are unable to protect themselves. Protect patient information. Protect your patient from harm, and do not share the patient information with other individuals. Okay, so whatever information a patient gives you, even if you know the parents of the patient, and it is a condition that you don't have to share with even your colleagues about a patient's condition. So that is non-malfeasance. We have what we call justice. Justice is a complex ethical principle with meanings that range from the fair treatment of individuals to the equitable allocation of healthcare resources. Fidelity is about being faithful or keeping promises, always doing what is right. Okay, if you tell a patient come by 8 a.m., be there by 8 a.m. Okay, I'm using African time. I don't know about other countries. I hope 8 a.m. in other countries is not what we have this side. All right. So we see that pharmacy laws and regulations, we have objectives for it. That is like that, the pharmaceutical premises, and then legal requirements for location and suitability of various pharmaceutical premises, and then legal implications of practicing beyond scope. So this will be our third lecture under pharmacy laws and regulations. I wish you all the best and thank you for listening. If you came this far listening to this specific video, thank you for listening. I request you subscribe and turn on the bell so that you get notifications whenever we upload new videos.